Okay. Now it's recording. Yep. Okay. Alright. So today we're going to assess the lungs, the cardiac system, and the abdomen. Okay. His skin is consistent with the rest of the skin on his body. He has normal hair for male, just normal hair distribution for a male pattern. He has a few macules noted throughout and keloids here, a macule there. There is pulsations and respirations noted. It is symmetrical. The anterior and posterior diameter of the chest is equal to half of that of the transverse. Okay, I think that's it. Alright, so for palpation, is there any tenderness here?
No.
Okay. Alright, so I want to have you turn to the side so you can see me do this. Okay. So when you feel my hands on your back of your chest, back like this, just keep saying 99.
99, 99, 99, 99, 99.
Okay. Tactile firmitus is noted and it's symmetrical on the ulnar aspect of my hand. I'm going to check for his thoracic expansion. So sit up for me. And my thumbs should move out equally and symmetrically with his expansion. Take a good deep breath in and out for me. Okay. And my hands moved symmetrically and equally with his breathing. Okay, so lean forward for me and cross your arms in front of you. Okay, I'm going to percuss his lung field. Okay, alright, and then I'm also going to measure his thoracic excursion. So what I want you to do is inhale for me and hold it at the inhale. Okay. Okay. Alright. Now, you can let it go and just breathe normally for a minute. Okay. So taking a good deep breath and exhale and then hold the exhale. Okay. Alright, I'll measure that. Okay, and I have 5 centimeters. The normal is 3 to 5. So now I'm going to listen to your lung sounds. You can just breathe normally for me. Okay, can you turn around to the front normal? Put your hands on your head. put your hands down. Okay. The lung sounds are clear and equal bilaterally, and there's no adventitious. That's going to hurt my. Adventitious breath sounds noted. Should be laughing at. Okay. So. Measured for that in the chest excursion. Had to do the 99 palpated. Okay. Alright, so, and there is no bulges or masses or anything unsymmetrically noted on his chest and back. Okay, so now we're going on with the cardiac exam. So I'm going to have you sit up straight for me with your hands to your side. Okay, now lean forward. Put your hands to your head. And then you can sit up straight. Okay, so the chest is symmetrical. The hair distribution is normal for a male. He has a few keloids and a few macules. There is respirations and pulsations noted. So now we're going to palpate the chest, palpate the base of the heart, the lateral aspect, and the apex. There's no tenderness there, right?
No.
And then the point of max impulse, which is fifth intercostal space, mid-clavicular line. It is also the apical pulse in the mitral valve. And the pulse is palpable. There is no thrust, lifts, or heaves noted. So now I'm going to palpate all of his pulses. Temporal, and then the carotid, do one at a time. Radial. Okay. Popliteal. Okay. Posterior tibial. And dorsalis pedis. And then there's the femoral, which we deferred. All of his pulses are strong and equal bilaterally. They're regular. There's no bounding or threading. So now I'm going to auscultate the different places on the heart and his carotid and his temporal. Okay, so this is the apical pulse. Which is fifth intercostal space, mid-clavicular line. It's also the mitral valve. Okay, and then fourth intercostal space, left sternal border, which is the tricuspid. And then Erb's point, which is third intercostal space, left sternal border. Did I say tricuspid? I meant Erb's. Oh, anyways. You with me? Okay. And then second intercostal space, which is the pulmonic, left sternal border. And then the second intercostal space, which is the aortic. Okay. I'm going to auscultate its temporal. Okay. There is no bruits or murmurs noted. No S3, S4 sounds. The S1 and S2 was readily hearable. Was clear. Alright, so now we're going to do the abdomen. So I'll have you lay on the bed there. Let me move this. Okay, I think it can see me. It's a very bad light. Here, if I can try not to block the camera. Okay, alright, so the abdomen is flat, it's symmetrical. There is, it's positive for pulsations and respirations, and he has striae, and there's some primary lesions, and then hair distribution's normal. It's negative for peristalsis. It has some vascular pattern. The umbilicus is a continuous ring. It's negative for colon sign, and it is inverted. So now I'm going to listen to your abdominal sounds. Okay, all four quadrants. Okay, and there's sounds heard in all four quadrants, anywhere at a rate between 5 and 35. I'm going to listen for a friction rub over the organs, liver, kidneys, and then the spleen. Okay, and there's none noted. We'll listen to the abdominal aorta, which is to the left of the center line, and it's right below the costal space. Okay, and then the renal. Okay, and then the iliac. And then we're going to defer the femoral. And there's no bruits noted there. Now I'm going to percuss the abdomen. And the sounds you're hearing here is tympani. Okay, and then the bladder is dull. Okay, and then around the costal margin is going to be dull as well. So we are going to palpate and measure this, or we're going to measure the spleen. We do this by percussion from tympani to dull and resonant to dull. So we just mark whenever we hear it change. Okay. Sorry. It's up here. Okay. We lost my place. measure it. Okay, and I have right at 5.5. Normal 6 to 12. And so then we're going to percuss the spleen. Alright, so there's tympani all around the area there, the costal margin. Then in the costal margin you'll have a mixture of resonance and dullness. Okay, so that lets us know that the spleen is in the correct place and that it is not freely palpable, which is a normal finding. So now I'm going to palpate the liver. So I want you just to lay normal, and I'm going to lift up on you, and then when I tell you to, I want you to cough. Okay, cough. Okay. The spleen, jeez. The liver is it is smooth. There's no nodules, calcifications, and no ridging. The spleen, as we talked about before, is not palpable, which is a normal finding. But I am going to palpate the kidney, so I'm going to lift up on you. You don't lift up. And you can find those retroperitoneal on both sides. Okay. And let's see. Leah, okay. And let's see, I palpated spleen, and all that.